Male fertility is declining worldwide. Not in theory. Not in the future. Right now. Healthy sperm count is the foundation of reproduction. Yet many men never test it, never think about it, and never realize something is wrong. Low sperm count doesn't make noise. But it changes lives. In this documentary, we're uncovering the science, the hidden causes, the lifestyle triggers, and the medical truths behind one of the most misunderstood male health conditions. If you have a body, this matters. If you want children someday, this matters even more. Let's start at the beginning. Let's begin with clarity. Low sperm count, medically known as oligospermia, means there are fewer sperm cells than normal in a semen sample. According to the World Health Organization, a healthy sperm concentration is at least 15 million sperm per milliliter of semen. Below that threshold, fertility decreases. It does not mean pregnancy is impossible. It means the odds are lower. And when sperm count drops extremely low, or reaches zero, natural conception becomes very difficult. But sperm count alone is not the only factor. Doctors also evaluate movement, shape, and overall sperm health. Still, count is the foundation. To understand what lowers it, we need to understand how sperm are made in the first place. Sperm production begins in the testicles. Inside each testicle are tightly coiled structures called seminiferous tubules. Within those tubules, specialized stem cells divide continuously. This process is called spermatogenesis. It takes approximately 64 to 72 days for one immature cell to transform into a fully developed sperm cell. That means the sperm produced today actually began forming over 2 months ago. Sperm production depends on 3 essential factors. Proper hormone balance. Healthy testicular tissue. Correct temperature. Disrupt any one of these, and production slows. Disrupt them severely, and sperm count drops. The body regulates this process carefully. The brain plays a central role. The hypothalamus in the brain releases a hormone called GnRH. That stimulates the pituitary gland. The pituitary gland releases 2 more hormones. FSH, follicle-stimulating hormone. And LH, luteinizing hormone. LH signals the testicles to produce testosterone. FSH directly stimulates sperm production. Testosterone fuels the entire system. If testosterone drops, sperm production declines. If FSH signaling is weak, sperm production declines. If the communication between brain and testicles is disrupted, sperm production declines. Hormonal imbalance is one of the most common internal causes of low sperm count. This can result from genetic conditions, pituitary disorders, chronic illness, or external hormone use. When men use anabolic steroids to build muscle, the body detects high testosterone levels and shuts down natural production. The testicles shrink. Sperm production can fall dramatically. Sometimes it recovers. Sometimes it does not. Now let's talk about structure. Varicocele is an enlargement of veins inside the scrotum. It is similar to varicose veins in the legs. These enlarged veins disrupt normal blood flow. When blood pools, heat increases. Sperm require a temperature slightly lower than core body temperature to develop properly. Even small temperature increases can impair production. Varicocele is one of the most common reversible causes of low sperm count. Many men never notice it. Some feel a dull ache. Others discover it only during fertility testing. Surgical correction often improves sperm count significantly. Infections can directly damage sperm production or block sperm transport. Sexually transmitted infections such as gonorrhea and chlamydia can inflame reproductive tissues. Inflammation leads to scarring. Scarring can block sperm from exiting the testicles. Other infections, like mumps after puberty, can damage testicular tissue itself. When the cells responsible for sperm production are injured, recovery may be limited. Early treatment matters. Ignoring infection can lead to permanent consequences. Not all causes are structural or hormonal. Some are behavioral. Smoking introduces toxins into the bloodstream. These toxins damage DNA inside sperm cells. They reduce count. They reduce movement. They increase abnormal shape. Alcohol, especially in excess, disrupts hormone balance. It reduces testosterone levels. It impairs liver function, which affects hormone metabolism. Recreational drugs such as marijuana and cocaine also impact sperm concentration and movement. Chronic stress elevates cortisol. High cortisol suppresses testosterone. Poor sleep interferes with hormone cycles. Sperm production is energy-intensive. The body will not prioritize it when under constant stress. Body fat is hormonally active tissue. It is not just stored energy. Fat cells convert testosterone into estrogen. As body fat increases, estrogen rises. Testosterone falls. Lower testosterone means reduced sperm production. Obesity also increases inflammation throughout the body. It raises scrotal temperature. It disrupts insulin regulation. All of these factors compound. Weight loss alone has been shown to significantly improve sperm parameters in many men. The testicles are located outside the body for a reason. They need to stay cool. Frequent exposure to heat can impair sperm production. Hot tubs. Saunas. Tight clothing. Prolonged laptop use on the lap. Occupations involving high heat environments. Heat stress does not always cause permanent damage. But repeated exposure reduces sperm count during that 2 to 3 month production cycle. Industrial chemicals. Pesticides. Heavy metals. Air pollution. These substances can interfere with hormone signaling and damage reproductive cells. Research from Harvard University has shown correlations between environmental toxin exposure and reduced sperm quality. Modern life exposes men to more endocrine-disrupting chemicals than ever before. Plastic additives such as BPA mimic estrogen in the body. Long-term exposure may impact fertility. Certain chronic illnesses lower sperm count. Diabetes affects blood flow and nerve function. Autoimmune disorders can cause the body to attack its own sperm cells. Genetic conditions such as Klinefelter syndrome affect testicular development. Cancer treatments like chemotherapy and radiation damage rapidly dividing cells, including sperm-producing cells. Some men recover fertility after treatment. Others require assisted reproductive techniques. Low sperm count is not visible. It does not change a man's strength or intelligence. Yet when diagnosed, it can affect identity deeply. Many men equate fertility with masculinity. They feel shame, embarrassment, silence. Relationships can suffer under the weight of unspoken stress. It is important to say this clearly. Low sperm count is a medical condition, not a personal failure. Diagnosis begins with semen analysis. A sample is examined under a microscope. Doctors evaluate concentration, motility, morphology. If results are abnormal, repeat testing is done. Hormone blood tests measure testosterone, FSH, LH. Ultrasound imaging may detect varicocele or blockages. Genetic testing may be recommended in severe cases. Accurate diagnosis determines treatment. Treatment depends on cause. Hormonal therapy may correct imbalances. Surgery may repair varicocele. Antibiotics treat infection. Lifestyle modification can significantly improve sperm count within 3 months. In cases of severe low sperm count, assisted reproductive techniques offer hope. Intracytoplasmic sperm injection, known as ICSI, allows a single sperm to be injected directly into an egg. Even with extremely low counts, fatherhood remains possible for many men. Protect fertility early. Maintain healthy weight. Avoid smoking. Limit alcohol. Manage stress. Get adequate sleep. Avoid excessive heat exposure. Seek medical evaluation when trying to conceive without success after 1 year. Earlier if over age 35. Fertility is not just a women's health issue. It is a shared responsibility. Low sperm count is not the end of the story. It's the beginning of awareness. And awareness gives you options. If this helped you see your body differently, pass it on. Leave a comment. Ask a question. Share your experience. Someone watching right now needs to know they're not alone. Subscribe for more science-based, No nonsense breakdowns of the human body. Your health is your responsibility. And your future deserves attention.